Let's talk about depression. It's a common term. People will just talk about, I'm depressed, I'm not feeling good, I'm sad. When we're actually defining it from a mental health standpoint, we're going to use the DSM. The first part is we're going to look at 9 specific symptoms, and you got to have them for at least 2 weeks. We have to see at least 5 of them. 2 of those have to be an inability to enjoy things, which we call anhedonia, or depressed mood. This is where a clinician may try to get an idea of what kind of recreational activities do you like? Oh, I love going to a basketball game. Have you done that? Yeah. When I go now, it's like there's nothing there. There's no joy. I feel like I'm not even there. That's anhedonia, that persistent inability to enjoy things. Number 2, we're looking at depressed moods. They're sad, they're tearful, hopelessness. Their mood is really lowered. They're not feeling the kinds of things and enjoyment that they used to do. They're depressed in their mood. You need to have either anhedonia or a depressed mood, as well as another 4 or 3 more, depending on if you have 2 of those. Then we're going to go through things like how your appetite may change. Your weight could change. You could be losing weight. You could be gaining weight. It's their sleep. There's a real disruption in your sleep. All of a sudden, you're either sleeping all day or you're not sleeping at all. There is a sense of guilt or hopelessness that can develop. People can notice a kind of psychomotor changing. This is a feeling of being really restless, revved up, or completely slowed down. It's like you're moving in slow motion. Your inability to concentrate. You're no longer able to focus on things that you normally could. There can be suicidality, starting to think about death and wishing you were dead. All of these are different symptoms, and we're looking for at least 5 of them over at least 2 weeks. Once we've established that, you then go through 4 rule out criteria to make sure that someone meets major depression. 1 has to be clinically significant. Evaluation is going to happen with a clinician, a therapist, or a psychiatrist, and they're going to be comparing it to other people that have presented with similar problems. 2, we have to make sure it's not some sort of physiologic response to a medication or drug. Someone who's started on a new medication by their doctor, started taking an herb or a supplement, or who's abusing drugs that's causing the problem. 3, we have to rule out any other mental health disorders that can convolute the picture. And the last one, number 4, is evaluation to make sure that they don't have bipolar disorder, because it really changes the medications and the treatment options that are effective, as well as some risks.